All right, good morning, everybody. We're here with some very good news today. We're sharing that over the past 2 years, we've added 323 staffed beds across the healthcare system here in Manitoba. Having more beds in the healthcare system is what the experts have been telling us for many years is what we need to be able to fix our healthcare here in Manitoba so that you can get the care when you need it, that you can get that care closer to home, and importantly, that the staff, the amazing staff who work on the front lines in facilities like the St. Boniface Hospital here, that they have the support and the resources to be able to do what they do best, which is to help you heal and to live a good life. So I want to thank all the people who've been stepping up to help us hit this important milestone. These 323 beds that we're talking about today include 10 new intensive care unit beds. And that's really important as we head into respiratory virus season, flu season, as it were. And so we know that this is a time of year where the emergency rooms and the parts of our healthcare system that we turn to every year start to see more and more demand. And we've been able, by working with nurses, working with doctors, working with allied healthcare professionals, working with the healthcare aides, to bring hundreds of new beds online to keep people healthy in the community. And of course, when you do need to visit a hospital, to get that healing, to get you back on the way sooner. Our plan to fix healthcare was first about the staffing. So we hired 3,400 new frontline healthcare staff. And then the people running our hospital said, we need to deploy those staff to open up new beds in the system. So now we've done that. And we can say that we've added 323 new beds at hospitals across Manitoba. And so we're proceeding with this sequential, methodical, careful plan to make healthcare better, but to do it in a way that's sustainable. Do it in a way that delivers real assistance for people on the front lines. Of course, there's a lot more work left to do. When we get to the stage of repairing the damage of what was caused under the previous government, it's not going to be fixed overnight. But what we are saying, heading into this year's flu season, is that we're better prepared this year than we have been in years past. And it's all thanks to you. It's thanks to you, those on the front lines. It's thanks to you, those who've been stepping up to help us rebuild healthcare across Manitoba. And it's thanks to you, the people of Manitoba, who've identified healthcare consistently as our #1 priority. So on behalf of the government of Manitoba, I want to say thanks, and let's keep working together to fix healthcare in Manitoba for all of us. Miigwech merci. Thank you very much.
Merci, Miigwech, Premier Kinew, for that update and for your leadership in improving access to health care in Manitoba. Next, I'd like to invite the Minister of Health, Seniors, and Long-Term Care, Uzoma Azaguara, to share more details about today's announcement. Minister Azaguara.
Thanks so much, Robert. Thank you. Thank you, Robert. Thank you, Premier. Thanks for joining us, Dr. Roussin, and thank you to the frontline staff. I see folks who are around, hanging around. Hi. It's good to see you folks. I would echo the Premier's sentiments. Thank you so much. We've been able to do what we've been able to do, opening up hundreds of new beds across the system by working together and by listening to the frontline healthcare workers who have been an active part of us rebuilding healthcare in Manitoba. We know that we're about to be in a very challenged time of year in terms of the pressures and demands that we see in the healthcare system with flu season, with respiratory virus season upon us. There are moments that we know are going to test our system's capacity and that remind us why preparation matters. When we came into office, we knew the system had been through a lot. That was very, very clear to us. We also knew, and it was very clear, that there had been a complete lack of preparation and planning in advance of the pressures that we know befall our system every single time this time of year. Years of cuts and underinvestments in healthcare left hospitals short on staff, short on space, and stretched beyond their limits. Cuts to beds, cuts to the folks who provide care at the bedside had massive consequences on our healthcare system and on the ways people access care. Manitobans made it clear they are ready for a government that would listen to frontline workers and start fixing the system that had been broken by the previous government, and that's exactly what we've been doing. Step by step, rebuilding capacity and confidence in our healthcare system. And so the bottom line is we've made some big strides. We've hired over 3,400 net new healthcare workers to staff these beds, to support the front lines. In addition to the 3,400, it's important that we talk about what the Premier shared today, that we have 323 net new, fully staffed beds now added to our healthcare system. This was done in under 2 years. 10 of those beds are ICU beds. Those are beds that care for our sickest Manitobans. And another 34 beds are set to open this year. We've strengthened capacity in our hospitals by adding more people, more beds, and more innovation. So we know that all of this means more care and more timely care for Manitobans. And it helps ensure that as demand rises, as it will during this season, that our plan is already set in motion. Across our province, care teams, paramedics, clinical leaders, they all have their plans in place. If one site fills up, another will open. If pressure builds, additional spaces will become available. The focus here is on ensuring the system can adapt while under strain and continue to provide care to those who need it most. This is what system readiness looks like, and it's what coordination and flexibility need to look like in our healthcare system. Every year, we know that respiratory season presents us a challenge, and it's important that as a government, we've worked with the front lines and listened to the front lines and experts in Manitoba so that we are prepared. So at the end of the day, we know that it's not just about beds, it's not just about hospitals, it's about people. People who work within these centers, it's about people who provide care to Manitobans each and every day, and it's about the people we're going to continue to work with to strengthen and build more capacity as we move forward. You should know as Manitobans that your leaders, your healthcare workers, your experts are all working together to make sure that the care you need is there where and when you need it. So thanks so much, folks.
Good job. Merci. Thank you, Minister Azaguera, for those details and for your ongoing commitment to Manitoba's healthcare system. Now, to provide a community perspective, we'll hear from Dr. Brent Rusin. Dr. Rusin, good morning.
Good morning. Thanks, Premier and Minister. So every year we see respiratory virus season put significant strain on the healthcare system. We see increasing admissions, we see pressures on ICU, and that even leads to delayed surgeries. That's why it's so important that as a province and our partners, we plan and prepare together before this season begins. For the past several seasons, Manitoba's respiratory virus planning table has brought together representatives from both public health, shared health, the regional health authorities to collaborate. We track trends to share information and then prepare and respond as needed as we see respiratory virus season upon us. This year we're better prepared. The province's investments in hospital and ICU capacity, along with this planning work that starts months in advance, we see a system that's stronger in a position to handle the known upcoming increasing demands related to respiratory virus season. We know that the Manitobans that are most at risk are those over age 65, those under age 5, and then those with underlying medical conditions, especially cardiovascular disease and diabetes. We know that vaccine is the most effective way to protect ourselves and others. Every year, when we review our ICU admissions, we see that almost no one admitted to ICU related to influenza is vaccinated. And we see that almost everyone admitted to ICU has underlying chronic medical conditions. So we can see really that the importance of getting vaccinated, especially if you're in those high-risk areas. So influenza and COVID-19 vaccines are available across the province. This year, in addition, Manitoba has increased access to nirsevimab, which is a long-acting antibody which protects newborns in their most vulnerable year against RSV, respiratory syncytial virus. So finally, we know that simple steps can make a huge difference. Staying home when ill, washing our hands, covering our coughs, and for sure getting vaccinated are some of our best ways to protect ourselves or others and try to decrease some of these demands on our healthcare system. So thanks very much, and happy to take any questions.
Thank you, Dr. Roussin, for sharing your experience and perspective. This concludes our formal remarks. Thank you for all of our speakers and everyone here for attending today's announcement. This marks an important step forward in ensuring better access and improved care for Manitobans across the province. We'll now open the floor to media questions.
We're pushing for the end of the calendar year, but it could be up until the end of fiscal, but those beds are actively coming online.
And what do you say to Manitobans who try to equate today's announcement with wait times, that there's still some in hospitals, 300 new beds, but there's still extremely long wait times?
I think it really does show Manitobans the magnitude of the damage done by the previous government. We lost over 500 beds from the system under the previous administration, hundreds of healthcare workers, and our 3 largest emergency rooms in Winnipeg. We knew our top priority had to be staffing the healthcare system. We are actively adding more net new healthcare workers in addition to the over 3,400 we now see working in healthcare in Manitoba. We've added 323 new beds that are fully staffed. I think it's really important to note what the Premier stated. These beds have been added methodically, intentionally, and in a sustainable way. Right? These are fully staffed beds as we continue to add more beds and more capacity. So every single year we've worked very hard to get the system better prepared for flu season, for respiratory illness season. And I think that it's pretty clear that and the alternative to this is not an option. That if we had been on the previous path, it would be catastrophic. We're building more capacity. We're seeing the benefits of that in our system. But of course, there's much more work for us to do. So we're going to keep adding beds, adding human resource to the front lines, and making sure that we're moving those wait times in the right direction.
What are the distribution of these beds? Just why are we not seeing them impact these wait times? Why are we not seeing the improvement? 300 beds.
Over 300 beds is a lot of beds. You're absolutely correct. We have beds in acute care, so a lot of medicine beds, dozens of those, psychiatric beds, critical care beds. We have beds in the mental health space. We've got beds internal medicine. And we've got also transitional care unit beds that we've brought online in community. So lower acuity levels of beds that are accessible now as well. The bottom line is, you don't fix the kind of damage that we are dealing with in healthcare as a result of previous cuts and mismanagement overnight. It takes us time to rebuild and repair healthcare. But every single year, as Dr. Roussin said, we are better prepared than we were before, and we're better to able to respond to the needs of Manitobans. Just last week, we were able to show Manitobans that we're leading the country in Manitobans being able to access a family doctor. Right? If you're sick and you see a provider, you can do that much more quickly here in Manitoba than anywhere else in the country. Those are steps in the right direction. But to fix wait times takes time, and it takes more capacity, and we're going to continue to do that work.
Minister, we got confirmation from police this morning that there was another assault at HSC yesterday. An on-duty doctor was assaulted by a patient. What's your message to patients and staff at HSC when we continue to see these incidents?
Well, first I would say, that any incident of violence is unacceptable. Healthcare workers should be safe to provide their jobs. They should know they're going to go to work and be safe at their employment and go home and see their families at the end of the day. Any incident of violence is unacceptable, and there's no place for that in healthcare. I would also express my thoughts with the physician who was affected, who I spoke with briefly this morning, and I will be speaking with later on today. Our frontline healthcare workers show up every day wanting to provide the best care to Manitobans they possibly can. And our government is going to continue to work very hard to make sure that Health Sciences Centre and sites across the province are safer and more secure every single day that we move forward. November 1st marked 24/7 police presence at HSC. We have dozens and dozens of institutional safety officers there. I want to thank the Winnipeg Police Service, who were very quick to respond and were the first to respond after the incident and attend to this physician. And so we're going to continue to work with the front lines, work with Health Sciences Center leadership, and take additional steps to improve safety and security. But I can't emphasize enough, healthcare workers deserve to be safe at their jobs. And acts of violence, incidents of violence are totally unacceptable. There is no place for that.
And you mentioned there your government could be taking additional steps beyond, like you mentioned, policing their 24/7. Now, what could those additional steps be in the near future?
In the very immediate near future, we're going to be seeing those weapons detectors come online, so additional 5 weapons detectors at Health Sciences Center. We've reduced the number of access points by way of the entrances at Health Sciences Center, improving safety and security on campus, in the tunnels, surveillance, and we're working with community support providers to make sure we're taking a community-focused approach as well for the entirety of the campus. So we've added more institutional safety officers than we initially planned to at Health Sciences Center. We went from 0 when we came into office. There were no institutional safety officers, not only at HSC, but anywhere in Manitoba. We now have about 120 to about 130 who are practicing, working in Manitoba, and dozens of those at HSC. So there's more work for us to do. We're going to continue to make sure that safety and security is a top priority so that healthcare workers, nurses, doctors, and visitors and patients alike are all safe and secure when they go to provide care or to receive care.
Minister, I'm wondering, what's your reaction to the preliminary data that shows that there's a significant drop in overdose deaths in the province?
That's good news. You know, our government has been working very hard. Minister Smith, who's the minister responsible for addictions, housing, and homelessness, the Premier has given us a very, very clear mandate to ensure that we're providing more services, more healthcare options, and more treatment for those who are struggling with addictions. And so I know that her team and our entirety of government has worked very, very hard to make sure that we are reaching people and meeting people where they're at in their challenges with substance use or addictions, and meeting their needs, taking a wraparound approach. So seeing a reduction is a positive. We also recognize there's much more work to be done. We've brought forward legislation that will ensure that folks who are struggling with substance use actively can be kept safe and receive primary care and support in those moments. So there's more work to do on this front, but we want to continue to move in the right direction.
Do you have a sense of what might be behind the drop?
There's a lot of work that our government has done alongside incredible community partners, alongside experts in this province who for years were waiting for a government that would respect their expertise, listen to what they had to say, and work in collaboration to ensure that Manitobans who are struggling with addictions are treated with care, compassion, and provided the services and the resources they need to move out of their addiction, to get access to treatment, detox, stabilization, primary care. And so we have worked very hard from day one, again, at the Premier's mandate and the mandate that Manitobans have given us to make sure that there are services and resources in place, make sure there's housing in place, make sure that we're giving the resources necessary to our community agencies and organizations to meet people where they're at. And when you start doing that work at a grassroots level, when you work with experts, when you listen to healthcare experts, and when you meet people in community, you start to see those important changes. So again, there's much more work to do, but I think that you've seen also through our work with the Your Way Home initiative, you know, meeting people in encampments, getting them housed, wraparound supports has its benefits.
Dr. Rusin, do you have an idea about flu shot uptake this year, or COVID booster uptake?
So it's really early on. So right now we're just seeing about 10% uptake reported, but quite early, and so there's a delay in reporting. So over these next couple of weeks, we'll start seeing the true numbers.
And then just since the pandemic, have you seen those COVID booster numbers go down? Are people gradually not getting boosted for COVID-19?
Certainly, the uptake for COVID-19 vaccine has dramatically dropped over the last number of years. Where last year we saw, about 16% of Manitobans get vaccinated. Of course, that's a much higher proportion of those over 65. So over half of those over 65 are receiving it. Where influenza has stayed relatively stable. We saw about 23% uptake last year of influenza.
What would your message be to Manitobans considering this drop in COVID-19 booster uptake?
I think that what we're trying to message is that respiratory virus season is actually quite predictable for much of it. The timing of it is difficult to predict, but we know every year who is at risk, and we know every year who we see ending up in hospitals and ICUs. It's those over 65, those with underlying medical conditions, and unfortunately we see it year after year that those in the ICU have just not been able to get vaccinated.
Premier Kinew, just before we go, are you able to give us some review of that?
Yes, absolutely. Alors aujourd'hui, nous sommes très contents d'annoncer que nous avons, pendant les dernières 2 années, ajouté 323 plus de lits tout partout dans le système de santé ici dans le Manitoba. Ça, c'est après embaucher plus que 3400 plus d'infirmières, médecins et puis les autres qui travaillent dans le système de santé. Et c'est à cause de vous, le peuple du Manitoba, qui ont dit toujours qu'améliorer le système de santé est votre priorité numéro 1. Alors ça, c'est 323 dans le système de santé, comme les hôpitaux, comme ici à Saint-Boniface, mais en même temps, c'est aussi 141 lits dans les soins et les foyers pour les soins des aînés aussi. So there's also 141 PCH beds over and above the 323 that we're talking about. I added in French there. Thanks.
On a separate topic in English, I'm just wondering what you make of the report ruling against the mandatory child support. That's something
I didn't hear the very last part.
that's something you agree with, this report ruling, what your thoughts are?
No, absolutely not. Child sexual abuse images and video, this is like one of the worst things that anyone can do. Not only should go to prison for a long time, they should bury you under the prison. You shouldn't get protective custody. They should put you into general population, if you know what I mean. Skinners? This is the worst. And this is why when we brought forward Bill 50, we have this ability to use a notwithstanding clause. So I call on people to support Bill 50, a reasonable way to operate under our current constitutional framework here in Canada, but in this case, to take action. So I know my friend Doug Ford has spoken out against this. I know Premier Smith, the federal leader of the opposition, Pierre Poilievre, have all made comments on this. And yeah, I think I'm on the same page as they are. I think the average person out there hears an announcement like this and just kind of shakes their head. And this is why our Bill 50 was brought into place, so that, yeah, we can protect people's rights in Manitoba, but there's still the ability for a legislature or parliament to take action when you hear something like this. It just doesn't make sense to the average person.
Premier, do you have any comment on the ethics commission resigning?
Jeff Schnoor is an amazing guy. Like, he's written his magnum opus, which was this document that found that Heather Stephenson broke the law, and he fined her $18,000 as well as 2 other PCs. But he's just a decent person. When you talk to Jeffrey Schnoor, you can have a laugh, you can have a smile, but you know that you're getting somebody who is committed to ethics and making sure that Manitobans have the best of public servants. So I wish him well. I'm sad to see him go, and he leaves very, very big shoes to fill.
Any concerns? I mean, first the housing minister or the commissioner, now the ethics commissioner. I mean, you have a couple resignations happening now.
They're very different situations because Jeffrey Schnoor is an independent officer of the legislature. He is not a political staffer. Tessa was a political staffer. We're going to still work with her, right? She's going to be helping from a distance with the housing construction. So that's a great step forward. But I just want to make very, very clear, Jeffrey Schnoor is beyond reproach. He doesn't get down into this level of politics with the rest of us up here, right? Jeff is up here. He's independent. He happens to be moving on for, I think, reasons that he'd be happy to share with you. And I just want Manitobans to take a second to say, no matter how you feel about the day-to-day of politics in and out, there are some good people who put the public interest first and foremost, and Jeffrey Schnoor is one of them.
MC News, Canadian മലയാളികളുടെ വാർത്താജാലകം.